Hi guys, just got to the office, about to start, but I thought I'd do a quick video on patient information leaflets before we get going, because I see this a lot when we do role play practice for exams like CSA and PLAB 2. Patient information leaflets are great and they can be a really useful tool in a consultation, but there's a couple of things that I would think about before I use them. Number one, you don't need to jam pack or force a patient information leaflet into every single scenario that you do. I see this too much. People just put in a patient information leaflet at the end of a consultation as if it's something that we need to do or tick off. By the way, here's a patient information leaflet that might help. And there's no real demonstration of that I've chosen a leaflet for this situation as opposed to another, because I do it for every single situation out there. So number one, don't feel you need to cram it into every scenario. In some, it just doesn't help. Number two, if you're getting such a bit of drilling going outside. Number two, if you do it, make sure you can demonstrate or you show that you understand actually what's in that leaflet yourself, that you know the kind of stuff that's going to be talking about, and that you've thought about how it's actually going to add to this person's management plan, rather than I just give it to you and go and read it. So for example, if you do a case of stress incontinence and you want to give a patient information leaflet talking about pelvic floor exercises, that's fine. But you've got to show that you understand what a pelvic floor exercise is. You've got to show that you know what a pelvic floor exercise is, and you'd be able to show someone how to do it if you were going to, and this leaflet is just an aid to that. So Mrs. X, when it comes to this kind of incontinence, then one thing that we know does help is something called pelvic floor exercises, that they're exercises that strengthen the pelvic floor and reduce the leakage of urine. Now we can talk a bit about how they work, and I can give you a brief idea about what they are, but I said I can give you an information leaflet that can go through that in a bit more detail, and it will cover it in a bit more depth. Now that's better than just saying, here's a patient information leaflet, and I think some pelvic floor exercises might help. So you need to show and demonstrate that you understand what's in there and that you actually know the information on there yourself before you just dish it out. And the third thing that's really important about a PIL, or patient information leaflet, is that you've got to make sure that you have given them a line to come back, or an option to come back to you if there's anything on that information leaflet that they don't understand. So it's one thing just to give a leaflet about pelvic floor exercises, but you've got to put a couple of lines there. Look, if things don't make sense on that leaflet, or if you have any questions about it, obviously come back and we can go through things in a little bit more detail, because they can go into quite a bit of depth. And if you have any questions, I'm always here. So patient information leaflets are very, very useful, but they're a tool that can be used as part of a management plan. It's not something that A, needs to be forced into every single scenario. B, you've got to understand or show that you understand what's on there and how it's actually going to help this person. And C, you've got to leave an open line of communication in case there are anything on that leaflet that they're not quite sure of going forward. We cover all of this and how to do management plans properly in much more depth in our Immersion CSA courses, our Immersion PLAB 2 courses, and our Immersion Stage 3 courses as well. So have a look at the website, auroramedicaleducation.co.uk, for more details, dates, and get yourself booked on. Hope this helps. Hashtag Campus Will Bass, hashtag I went with Aurora. Have a great day.